Welcome to the 2023 NCLEX-PN practice test. This test will have 60 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it white.
Question 1. A gunshot wound victim is transported via EMS to the ED with no next of kin present. The patient needs emergency surgery to save his life. What is the proper way for the nurse to obtain informed consent since the patient cannot sign? A. Contact the person on the patient's chart who is next of kin. B. Contact the social worker for advice. C. Send the patient to the operating room with no informed consent. D. Have the physician sign for the patient. The correct answer is C. Send the patient to the operating room with no informed consent. In the event of an emergency, when there is no next of kin present, it is appropriate and legal to perform life-saving measures for a patient. The patient needs emergency surgery, so it would take too much time to call someone to obtain consent. The physician may not sign a consent form for a patient. Question 2. The first and most important step in the nursing process is assessment. Which of the following does assessing entail? A. Data collection and validation. B. Direct care. C. Goal setting. D. Evaluation. The correct answer is A. Data collection and validation. The first and most important step in the nursing process includes the assessment. As part of the assessment, the nurse gathers data and validates information given by the patient. This is so that the healthcare team can accurately care for the patient based on the information that was obtained. Question 3. The second step of the nursing process is diagnosis. Which of the following does diagnosis entail? A. Planning and implementation. B. Evaluation. C. Data collection and validation. D. Goal setting. The correct answer is A. Planning and implementation. The second step of the nursing process includes diagnosis. In this stage, the nurse has come up with a nursing diagnosis and makes a plan and implements it to care for the patient. For example, a nurse may diagnose a patient with risk for impaired breathing related to COVID-19 infection, as evidenced by increased respirations. The nurse would plan nursing interventions, sit the patient in a high Fowler's position, obtain order for oxygen, and implement such interventions. Question 4. According to Maslow's hierarchy of needs, a patient must have certain needs met. One of these needs is self-actualization. Which of the following does not fall into the self-actualization category? A. Spiritual growth. B. Point of view of others. C. Reaching their max potential. D. Acceptance. The correct answer is D. Acceptance. Acceptance is a part of the self-esteem need, which is part of Maslow's hierarchy of needs. An empowering environment is also a part of the self-actualization need. Question 5. A nurse is friends with a patient that she was caring for in the hospital. After the patient was discharged from the hospital, the nurse had not heard from the patient. The nurse went home and posted on the patient's social media page, "Hey girl, I was just checking in on you since you left the hospital." What has this nurse done? A. Broken the law. B. Written an unethical statement. C. Was dismissive of the patient's feelings. D. Nothing, she is checking on her friend. The correct answer is A. Broken the law. This nurse has broken the law and breached HIPAA. The patient is not currently in the care of the nurse. It is a breach of HIPAA for the nurse to be in the patient's chart when the patient is not in her care, whether they are friends or not. Question 6. The nurse on a neuro unit is caring for a patient who recently suffered a stroke. The physician orders for the patient to be advanced to a clear liquid diet from NPO. Before allowing the patient to drink, which of the following healthcare team members should assess the patient? A. An occupational therapist. B. Speech pathologist. C. A nutritionist. D. An ENT physician. The correct answer is B. Speech pathologist. The client's capacity to chew and swallow might be evaluated by speech therapists. Before increasing their diet, patients with dysphagia, trouble swallowing, should have a thorough swallow examination, especially if it is caused by a stroke or brain hemorrhage. Additional treatments and therapy would be necessary if clients were observed to exhibit aspiration or choking tendencies during swallowing. Question 7. You're the nurse caring for a patient who is newly diagnosed with CHF. You may ask the UAP to perform all of the following tasks except A. Reinforce the patient's diet. B. Educate the family on the reason for strict Is and Os. C. Provide Foley catheter care. D. Help the patient walk in the hallway to gain strength. The correct answer is B. Educate the family on the reason for strict Is and Os. A UAP is unable to teach or instruct for new diagnosis. The UAP is able to reinforce teaching, but this patient has a new diagnosis of CHF, and the RN should assess and teach, and assess for understanding. Question 8. What is the term for something that often entails giving responsibility for the outcome while assigning non-licensed assistance people to execute activities or duties linked to patient care? A. Delegation. B. Autonomy. C. Beneficence. D. Validation. The correct answer is A. Delegation. Delegation often entails giving responsibility for the outcome while assigning non-licensed assistance people to execute activities or duties linked to patient care. Making nursing decisions is a responsibility that can only be assigned by a qualified nurse. Question 9. What is the term for a collaborative approach that supports suggested treatment plans to ensure that patients with disabilities, illnesses, or injuries receive the proper medical care? A. Delegation. B. Case management. C. Care plan. D. Clinical approach. The correct answer is B. Case management. Case management is the term for a collaborative approach that supports suggested treatment plans to ensure patients with disabilities, illnesses, or injuries receive the proper medical care. Case managers work closely with healthcare providers, patients, and their families to develop and implement a comprehensive care plan, coordinate services, and advocate for the patient's needs. This approach helps promote effective and efficient healthcare delivery, improve patient outcomes, and address the unique challenges faced by individuals with disabilities, illnesses, or injuries. Question 10. The nurse on a medical surgical floor with 4 patients with medications due at 9 a.m. Which of the following patients will the nurse administer medications to first? A. A patient on warfarin for a DVT blood clot. B. A patient taking Humulin R that is about to receive their breakfast. C. A patient on Dilaudid for post-op pain with a pain level of 7/10. D. A patient on metoprolol for a chronic history of irregular heart rhythm. The correct answer is B. A patient taking Humulin R that is about to receive their breakfast. Regular insulin for diabetic patients should be delivered 15 to 30 minutes before the meal. This medicine administration is urgent and time-sensitive. Instead of prioritizing medications merely on the basis of age, priority should be given to the illnesses they treat and the status of the client who needs them. Question 11. Which of the following patients should be assessed first by the nurse? A. A patient with a chest tube with a water seal chamber that is dry. B. A patient with a Foley catheter bag that is full. C. A patient with stable AFib on digoxin. D. A patient with TB with a SaO2 of 91% and a RR of 22. The correct answer is A. A patient with a chest tube with a water seal chamber that is dry. The patient with the chest tube with a dry water seal chamber should be seen first because an improperly working chest tube can cause respiratory distress in a patient due to a collapsed lung. The full Foley catheter bag can be delegated to a UAP. Options C and D indicate a stable patient. Ideally, if a patient is in isolation, in other words, the TB patient, and stable, the nurse should assess that patient last and minimize visits into the room as much as possible. Question 12. You're a nurse working on the rehabilitation unit and have a new LPN shadowing you today. Which of the following should not be delegated to the new nurse? A. Assisting a post-op patient 12 hours out of surgery with going to the restroom. B. Feeding a patient with early-stage Alzheimer's disease. C. Teaching a family about ambulating for the first time. D. Foley catheter care. The correct answer is C. Teaching a family about ambulating for the first time. The RN should be the first nurse to assess and teach a patient about ambulation after surgery. This patient is considered the least stable and should not be assigned to the new nurse who is a LPN. Question 13. What is the term used to describe cross-disciplinary activity in medicine? For example, the nurse communicates with a physical therapist for home health needs of the patient. A. Collaboration. B. Cooperation. C. Autonomy. D. Intervention. The correct answer is A. Collaboration. Collaboration between nurses and other staff members guarantees more effective patient care and a more encouraging atmosphere where team members may advance in their profession. Collaboration between the nurse and physical therapist guarantees more effective patient care. Question 14. A nurse working in the ICU has a patient that is experiencing a sudden upper gastrointestinal bleed. What is the most important intervention? A. Place the patient in a Trendelenburg position. B. Place the patient in a supine position. C. Put the patient on their left side. D. Put the patient in a Sims position. The correct answer is A. Place the patient in a Trendelenburg position. Using the Trendelenburg position for patients with a high risk of hypertension, like with a large GI bleed, can be helpful in reducing the risk of hypertension. In order to increase surgical exposure of the pelvic organs, the surgeon Friedrich Trendelenburg invented the head-down posture, often known as the Trendelenburg position. The Trendelenburg position then became a frequently used technique in treating patients with shock and hypotension. The Trendelenburg posture has an increased cardiac output as its main consequence. While this is not a long-term therapy, initially placing the patient in a Trendelenburg position can help prevent hypotension. Question 15. A patient states to the UAP, "I can't breathe." Which of the following interventions, if provided by the UAP, would warrant correction by the nurse? A. The UAP places the patient on oxygen. B. The UAP put the patient in a high Fowler's position. C. The UAP takes a pulse oximetry reading. D. The UAP counts the respiration rate of the patient. The correct answer is A. The UAP places the patient on oxygen. A UAP should immediately alert the nurse of the patient's condition. The UAP can place the patient in a high Fowler's position and take vital signs. Oxygen is considered a medication and should not be administered by the UAP. Question 16. The nurse is caring for a diabetic patient who the nurse finds sweating and only able to mumble words. What is the first intervention for the nurse to take? A. Give the patient 8 ounces of orange juice. B. Check a POC glucose reading. C. Ask the patient when the last time they ate. D. Give the patient 4 graham crackers. The correct answer is B. Check a POC glucose reading. The first intervention should be to assess the glucose. If the nurse learns that it is in fact hypoglycemia, the patient should be treated promptly. If a patient is only able to mumble, they are likely not able to answer any questions from the nurse. Question 17. The nurse working on an L&D unit suspects her patient is having a seizure. What is the most important intervention for the nurse to provide? A. Place the patient on her left side. B. Call a code blue. C. Give the patient magnesium. D. Check a POC glucose on the patient. The correct answer is A. Place the patient on her left side. A patient having a seizure should always be placed on their left side to prevent aspiration. A rapid response rather than a code blue should be called. The nurse should not administer any medication without the order from a physician. Checking a POC glucose is okay in this situation, especially if the patient is diabetic, but it is not the priority intervention. Question 18. You're educating a 16-year-old female on oral birth control pills before she leaves the OBGYN's office. Which of the following statements by the patient assures you that the patient understands the teaching? A. If I have sex in the next week, I should have my partner wear a condom. B. If I miss more than 2 days of my birth control, I can just start where I left off. C. If my breasts begin to hurt, I need to take a pregnancy test right away. D. There is no extra risk for me even though I smoke cigarettes daily. The correct answer is A. If I have sex in the next week, I should have my partner wear a condom. When beginning new birth control, a patient should use a secondary form of protection, like a condom for the first week. It is normal for breast tissue to become tender and swollen with birth control pills. It is also contraindicated for a woman who smokes cigarettes to take an oral form of birth control due to the high risk for DVT blood clots. Question 19. A mother of a 5-month-old infant tells you that her baby is not sitting without support. She states, "My friend's baby is sitting without support, and I am worried that my baby is behind." What is your best response to this mother? A. It's okay. I will ask the doctor for a developmental referral. B. Most infants do not sit up unassisted until at least 6 months. They can sometimes take a little longer as well. C. No need to worry. My baby sat up unassisted at 6.5 months old. D. I don't think it's necessary, but I can ask the doctor for a developmental referral. The correct answer is B. Most infants do not sit up unassisted until at least 6 months. They can sometimes take a little longer as well. Infants usually do not start sitting up unassisted until 6 months, and sometimes beyond. There is no need for a developmental referral in this case. It is necessary for the nurse to encourage the mother that the infant is not behind developmentally. Question 20. You're educating a patient on his risks for CAD, coronary artery disease. Which of the following is not considered a modifiable risk factor for this patient? A. Sedentary lifestyle. B. High sodium diet. C. Smoking for 35 years. D. Family history of CAD. The correct answer is D. Family history of CAD. A modifiable risk factor is something that can be modified by the patient. A family history of CAD is out of the control of the patient. All other options may be changed by the patient. Question 21. Which of the following is not considered a primary preventative measure? A. Vaccinations. B. Use of birth control. C. Hand hygiene. D. Daily regimen of low-dose aspirin to prevent heart attack in a patient with a history of MI. The correct answer is D. Daily regimen of low-dose aspirin to prevent heart attack in a patient with a history of MI. Prior to a condition developing, primary prevention seeks to stop it. In order to achieve this, exposures to dangers that might cause illness or injury must be avoided, hazardous or unhealthy behaviors must be changed, and should an exposure occur, disease or injury resistance must be increased. Question 22. You're assessing an infant who is 6 months old. You ask the mother which foods have been introduced to the infant. Which of the following would require education from the nurse? A. Eggs. B. Honey. C. Squash. D. Mashed potatoes. The correct answer is B. Honey. Honey is contraindicated in infants less than 1 year of age as it may cause botulism. All other foods here are okay to introduce one at a time to a 6-month-old. Question 23. Which of the following is not a normal part of aging in the older adult population, 65 plus? A. Decreased sense of smell. B. Decreased balance. C. Sensitive eyes. D. Increased pain perception. The correct answer is D. Increased pain perception. Studies show that after age 70, the older adult tends to see chronic pain as a normal part of aging. They tend to downplay pain as they tend to suffer from situations that they feel are more painful, such as loss of a spouse. Therefore, these patients tend to report pain less often than their younger counterparts. Question 24. A patient presents to the ED with tachycardia, hypertension, and hallucinations. His EKG reveals SVT. The patient's temperature is 100.7. His wife states, he had a seizure that lasted more than 5 minutes before EMS arrived. Which of the following substances can the nurse anticipate this patient will test positive for in his urinalysis? A. Eto. B. Benzodiazepines. C. Methamphetamines. D. Barbiturates. The correct answer is C. Methamphetamines. Methamphetamines cause excitation of the nervous system. Patients who use meth presents with tachycardia, hypertension, hallucinations, abnormal heart rhythms, and hyperthermia. Seizures are very likely due to the effect that meth has on the nervous system. Question 25. A patient with breast cancer came into her PCP's office and stated that she feels extremely tired and worthless to her kids and husband. She states, maybe they will be better off when I am dead. The nurse understands that the patient needs A. Strong antidepressant. B. A referral to a psychiatrist. C. To be admitted to the hospital for 72 hours. D. To be evaluated for suicidal ideation. The correct answer is D. To be evaluated for suicidal ideation. This patient is exhibiting words of suicidal ideation. The number one concern for this patient is safety. The nurse must ask the patient specifically if she has a plan to harm herself. Question 26. A patient with schizophrenia has orders for Haldol IM stat due to extreme aggressive behavior due to hallucinations. When the nurse goes into the patient's room to administer the IM injection, which of the following is the most important for the nurse to ensure safety? A. To take 2 other nurses with them to help hold the patient. B. Leave the patient's door open. C. Speak calmly to the patient. D. Place the patient in restraints before administering the injection. The correct answer is B. Leave the patient's door open. It is important for the nurse to keep their own safety in mind as well. Patients with schizophrenia and other psychotic issues may act aggressive toward staff. It is important for the nurse to leave the door open to ensure an escape route. Options A and C are good practice but are not the most important. Option D is inappropriate without cause and a physician's order. Question 27. A patient who recently started a low dose of a benzodiazepine is at home experiencing a panic attack. The mother calls the patient's PCP and asks what she can do to help her child. What intervention should the nurse educate the mother on? A. Walk with the patient outside in the sun to get fresh air. B. Sit calmly with the patient and provide a feeling of safety and security. C. Distract the patient by turning on their favorite TV show. D. Give the patient a second dose of the benzodiazepine. The correct answer is B. Sit calmly with the patient and provide a feeling of safety and security. When a patient is in panic mode, they will be unable to perform activities. Having them walk or watch television can cause their panic to be worse. Giving a second dose of a benzodiazepine is inappropriate and may cause oversedation. Question 28. A mother who had a newborn 6 weeks ago calls the OBGYN's office and states that her infant never stops crying. The mother is not sleeping or eating, and that she feels overwhelmed because her husband works 12-hour night shifts. Which of the following questions is most important for the nurse to ask the patient? A. Do you have anyone to come over and help you? B. Do you have thoughts of harming yourself or your baby? C. How many times a day is the infant eating? D. Have you thought about coming in for an antidepressant? The correct answer is B. Do you have thoughts of harming yourself or your baby? This mother has stated that she has not slept and she feels overwhelmed. She is exhibiting signs of postpartum depression. Mothers may feel overwhelmed when they have no support system and an infant that seems to never stop crying. These women are at high risk for suicide or harming their infant. The nurse should immediately ask the patient if she has thoughts of harming herself or her baby. Question 29. A patient is admitted to the hospital for complications of her chronic pancreatitis. The patient states that she drinks 12 beers per day, as well as at least a pint of hard liquor most days. Which of the following medications should the nurse anticipate the physician ordering for this patient? A. Methadone. B. Naloxone. C. Naltrexone. D. Librium. The correct answer is D. Librium. Patients who may have withdrawal symptoms from alcohol can be prescribed Librium in the hospital to hinder withdrawal symptoms. Methadone is given to patients who are addicted to opioids. Naloxone is given to a patient who has overdosed on opioids. Naltrexone hinders the patient from feeling pleasure when drinking alcohol, but does not help with withdrawal symptoms. Question 30. A 16-year-old comes into the ED with severe abdominal pain to the right lower quadrant. What is your initial step when assessing this patient? A. Palpate. B. Auscultate. C. Percuss. D. Inspect. The correct answer is D. Inspect. The first step in assessing the abdomen is to inspect, as percussing and auscultating can alter the bowel pattern. After inspecting, auscultation should be done, followed by percussing and then palpitation. Question 31. Who should the numerical pain scale be used on? A. A nonverbal 6-year-old patient. B. An intubated patient. C. A patient in a doctor's office who is upset. D. A deaf 10-year-old with developmental delays. The correct answer is C. A patient in a doctor's office who is upset. The numerical pain scale is best used for adult patients. Other pain scales like the nonverbal pain scale, NVPS, should be used for intubated patients because a patient that is intubated is unable to speak. Pain scales such as the FLAC pain scale is used for children. Question 32. Your patient has a new diagnosis of stroke with a new prescription for warfarin. Which of the following will you educate your patient on? A. Increasing foods high in vitamin K like spinach. B. Eating low-fat foods. C. Eating low cholesterol foods. D. Eliminating foods high in vitamin K such as Brussels sprouts. The correct answer is D. Eliminating foods high in vitamin K such as Brussels sprouts. Warfarin prevents blood clotting by interfering with the role that vitamin K plays in a convoluted chain of molecular occurrences. However, vitamin K is a substance that is crucial for bone and heart health. Warfarin should not be used with vitamin K since it reduces the drug's efficacy. Question 33. Your patient is gasping for air. Which of the following positions are best to place the patient in? A. Trendelenburg. B. Semi-Fowlers. C. High Fowlers. D. Left lateral. The correct answer is C. High Fowlers. High Fowlers is the optimal position for a patient with respiratory distress to be placed in. High Fowlers involves the head of the bed, CHOB, to be at least 60 degrees up to 90 degrees. This position lowers the diaphragm and allows for optimal breathing. Question 34. Which of the following lung sounds would be most likely heard in a patient with an asthma exacerbation? A. Raunchy. B. Wheezing. C. Stridor. D. Crackles. The correct answer is C. Stridor. Stridor often denotes a blockage or narrowing of the upper airway, which is external to the chest cavity. Stridor is often seen in asthma because the airway is swollen and blocked. Question 35. You are providing catheter care to a patient with a suprapubic catheter. What is the best way to provide catheter care? A. Wash the tubing with soap and water beginning at the catheter bag up to the insertion site of the catheter. B. Using soap and water, wash the abdomen around the insertion site. C. Replace the catheter in the abdomen weekly. D. Wash the tubing with soap and water beginning at the insertion site on the abdomen. Washing away form the site down to toward the drainage bag. The correct answer is D. Wash the tubing with soap and water beginning at the insertion site on the abdomen. Washing away form the site down to toward the drainage bag. Cleaning away from the site significantly decreases the risk for infection for the patient. The best way to keep infection at its lowest, the nurse should start at the site of insertion, moving away from the site. Question 36. You're providing education on medications to a patient that you're discharging. What is the best way to be sure that the patient has understood the education provided? A. The patient repeats the information back to you. B. The patient writes down the information. C. The patient takes a picture of his discharge paperwork. D. The patient asks his wife if she understood the information as well. The correct answer is A. The patient repeats the information back to you. The best way to ensure that this patient understands the education provided is to have them repeat it back to you. Just because they write information down, take a picture of the medications or discharge paperwork, or have a family member there does not mean that they understand the education provided. Question 37. You're the home health nurse providing medication education to a 67-year-old male that lives alone. The patient states that he sometimes forgets to take his medications. How will you know that the patient knows how to take his medications? A. You check his pill box each time you visit. B. You write down his medications and the times he should take them. C. You count his pills each time you visit. D. The patient takes his pills in front of you and explains when to take each medication that he is prescribed. The correct answer is D. The patient takes his pills in front of you and explains when to take each medication that he is prescribed. While checking the patient's pill box is important to ensure that he is taking his medications, the best way to know that the patient understands how to take his medications is if he correctly demonstrates and explains how he is supposed to take them. Counting the patient's pills is not necessary. Question 38. A teenage patient is admitted to the ICU for overdosing on acetaminophen. You know the antidote for acetaminophen is what? A. Primogen. B. Protamine sulfate. C. Vitamin K. D. Acetylcysteine. The correct answer is D. Acetylcysteine. When a patient has overdosed on acetaminophen, the antidote is acetylcysteine. Acetylcysteine is used to assist avoid or decrease the liver damage brought on by an acetaminophen overdose. Question 39. A nurse is caring for a patient that is an alcoholic. She has been admitted to the hospital and will not be able to drink alcohol. What medication does the nurse anticipate the doctor prescribing for this patient to help with withdrawal symptoms? A. Chlordiazepam, B. Naltrexone, C. Ondansetron, D. Methadone. The correct answer is A. Chlordiazepam. Chlordiazepam, Librium, is often given to patients to keep them from experiencing the side effects of alcohol withdrawal. Naltrexone is often prescribed to help patients not crave the taste of alcohol. It lessens their pleasure of drinking alcohol. Ondansetron is for nausea/vomiting symptoms. Methadone is often given to patients addicted to opioids to lessen withdrawal symptoms. Question 40. The nurse is caring for a patient who has been receiving dilaudid 0.5 milligrams every 3 hours, scheduled for post-op surgical pain. The nurse is handing off report and notices that the patient's O2 sat drops to 88%. The patient's chest is not moving, and the patient becomes unresponsive. Which pharmacological therapy do you anticipate needing? A. Epinephrine, B. Naloxone, C. Diazepam, D. Naltrexone. The correct answer is B. Naloxone. The reversal agent for opioids such as Dilaudid is naloxone. This patient is experiencing signs of opioid overdose with decreased respiratory rate and O2 sate. Question 41. You're giving furosemide via IV push. You know to push it 20 milligrams per minute to prevent which clinical side effect? A. Tinnitus, B. Halitosis, C. Oliguria, D. Anuria. The correct answer is A. Tinnitus. In order to reduce blood pressure and treat edema brought on by water retention, loop diuretics like furosemide, Lasix, and bumetanide, Bumex, are frequently administered. However, loop diuretics are known to possibly lead to hearing loss and ear ringing. For this reason, furosemide should be pushed slowly to prevent tinnitus. Question 42. A patient is prescribed ferrous sulfate for her chronic anemia. Which of the following medications does the patient need to be educated on? A. Calcium carbonate, B. Salicylic acid, C. Ascorbic acid, D. Thiamine. The correct answer is A. Calcium carbonate, Tums, interfere with absorption of iron. For this reason, when a patient is taking ferrous sulfate, they should take calcium carbonate as far away from the dose of ferrous sulfate as possible. At least 1 hour before ferrous sulfate dose or 2 hours after ferrous sulfate dose. Question 43. The MD orders D5W2L to infuse over 12 hours. What is the rate of infusion? A. 125 ml over HR, B. 254 ml over HR, C. 133 ml over HR, D. 167 ml over HR. The correct answer is D. 167 ml over HR. In order to obtain the rate of infusion, the IV fluid should be changed to ml. 2L equals 2000 ml. 2000 ml divided by 12 hours equals 166.67 ml/HR. The IV pump should be set to 167 ml over HR. Question 44. A 20-year-old patient with Down syndrome is unable to perform oral hygiene and has no family with him. Which of the following is the responsibility of the UAP? A. Use a soft toothette to clean the teeth and tongue after each meal. B. Use a soft toothbrush to clean the gums, teeth, and tongue after each meal. C. Perform oral suction after rinsing the mouth with water after each meal. D. Have the patient rinse with water after each meal. The correct answer is B. Use a soft toothbrush to clean the gums, teeth, and tongue after each meal. When a patient cannot perform proper mouth hygiene, the UAP or nurse should clean the gums, teeth, and tongue after each meal. This prevents the patient from having a mouth infection. Mouthwash can irritate the oral mucosa. Water is not enough to clean the oral mucosa. A soft toothette is not strong enough to properly clean the patient's mouth. Question 45. A 7-year-old patient presents to the ED after falling from his treehouse. X-rays show that the patient sustained a green stick fracture. Which of the following correctly identifies a green stick fracture? A. It happens at the epiphyseal plate that has not yet stopped growing. B. Happens with great trauma and force to the end of the bone. C. Is also known as a hairline fracture. D. Are usually seen in the older adults. The correct answer is A. It happens at the epiphyseal plate that has not yet stopped growing. Green stick fractures are seen in children who are not finished growing. These children have epiphyseal plates that have not closed yet because they are still growing. Question 46. A patient presents to the ED complaining of a severe stomachache to her right lower abdomen. The patient is diagnosed with appendicitis after a CT scan. The patient is later admitted to the medical surgical unit. Which of the following, if stated by the patient, would indicate a medical emergency? A. My stomach is hurting so bad I just cannot take this. B. Finally, this pain has subsided. Maybe it was bad gas. Is the doctor sure I have appendicitis? C. When am I having this surgery? I'm so thirsty. I feel so parched. D. I hope I get to go home tomorrow. Surely I can take pain meds and feel better after my surgery. The correct answer is B. Finally, this pain has subsided. Maybe it was bad gas. Is the doctor sure I have appendicitis? This patient had intense pain and was diagnosed with appendicitis. If the pain is suddenly gone, this indicates that the patient's appendix has ruptured and the patient needs emergency surgery. Left untreated, this will result in the patient's death quickly. Question 47. A patient who has recently undergone a thyroidectomy has a positive Chvostek's and positive Trousseau's sign. These indicate all of the following except A. Hypocalcemia, B. Damaged parathyroid gland, C. Hypercalcemia, D. Hypomagnesemia. The correct answer is C. Hypercalcemia. A positive Chvostek's sign and a positive Trousseau's sign indicates hypocalcemia, hypomagnesemia, and a damaged parathyroid gland. Patients with a positive Chvostek's sign and a positive Trousseau's sign would not have hypercalcemia. Question 48. A patient presents to an urgent care stating that he noticed that his great toe is swollen, red, and tender. He states that it is so swollen that he has missed work for 2 days. The patient states that his diet consists of red meats and beer at least 5 days per week. Which of the following would the nurse most likely expect the patient to be diagnosed with? A. Cellulitis of the great toe, B. Gout, C. Rheumatoid arthritis, D. Osteoarthritis. The correct answer is B. Gout. A patient who has a diet high in red meat and alcohol is at a high risk for gout due to uric acid. This patient has the classic signs of gout, given that the pain and inflammation started in his great toe. Question 49. The nurse is assessing a patient with a new ileostomy. The nurse notices that the ostomy is purple. Which of the following is most likely the issue with the new ileostomy? A. Nothing. This is normal since it is outside of the abdomen. B. The bowel has become ischemic. C. The stoma has become dry. D. The stoma. The correct answer is B. The bowel has become ischemic. A stoma for any type of ostomy should be pink/red and moist. If the stoma is purple, it has become ischemic and is a medical emergency because the patient can lose that part of their bowel. Question 50. The nurse is caring for a patient in an external fixation device on an orthopedic unit. What is the most important nursing intervention for this patient? A. Offer high-protein meals. B. Encourage the patient to ambulate often to prevent contractures. C. Assess for excess redness around insertion sites. D. Ensure the patient is in a left lateral position while in bed. The correct answer is C. Assess for excess redness around insertion sites. When a patient is in an external fixation device, the insertion sites should be assessed often. These sites can become infected easily. Excessive redness, pus, and/or exudate can indicate infection at the insertion sites. The patients are usually on bed rest and are in a supine position. Question 51. The nurse is monitoring a 5-year-old for increased intracranial pressure after the child fell from his treehouse. Which of the following should be reported to the MD immediately? A. Coughing. B. Inability to say a 4-word phrase. C. The child says, "I see 2 of everything." D. Excessive laughing. The correct answer is B. Inability to say a 4-word phrase. It is not uncommon for a patient with increased ICP to experience diplopia, double vision. The child stating that he is seeing 2 of everything would indicate that he is experiencing double vision, and the MD needs to be notified promptly. Question 52. The nurse is caring for a patient that is 6 hours post-surgery with a Jackson Pratt drain. The nurse knows that the proper way to create suction is to A. Ensure that the drain is inflated and closed. B. Compress the drain and ensure it is closed. C. Fold the drain in half and ensure it is closed. D. Ensure the drain is below the insertion site and closed. The correct answer is B. Compress the drain and ensure it is closed. For constant suction, the collecting bulb should constantly be compressed. Pushing in the bottom end shouldn't be used to collapse the bulb since it doesn't provide suction. When the bulb is filled with fluid or stops sucking, it has to be emptied. Question 53. You're caring for a patient who is 6 hours post-surgery after a TURP, transurethral resection of the prostate. The nurse notices that there is bright red blood in the Foley drainage tubing. What is the correct intervention by the nurse? A. Notify the MD immediately. B. Increase the irrigation fluids connected to the Foley catheter. C. Place the patient in a Trendelenburg position. D. Gently massage the patient's bladder. The correct answer is B. Increase the irrigation fluids connected to the Foley catheter. Post-op TURP patients are usually receiving irrigation of normal saline via irrigation tubing that is set up to flow through the bladder and into the Foley catheter bag. It is a gravity system in which the nurse uses a roller clamp to increase or decrease the flow based on what color the urine fluid is coming out of the Foley tubing. The goal of irrigation is to keep the outflow a light pink color to avoid clotting. In this instance, the nurse is seeing bright red blood and should increase the flow of the irrigation. Question 54. The nurse is educating a patient who is receiving radiation therapy. Which of the following is most important to educate the patient on increasing in their diet? A. Vitamin B12. B. Water. C. Protein. D. Vitamin D. The correct answer is B. Water. Radiation therapy may cause a patient to become quickly dehydrated. Patients should be educated about dehydration and how to combat it as well as extremely dry skin. Question 55. Which of the following is most important to educate a patient on when receiving chemotherapy and radiation therapy? A. Take excessive precautions when you will be exposed to the sun. B. Be sure to stay at least 12 feet from others to avoid becoming sick. C. Be sure to check your BP daily. D. Be sure to increase vitamin K in your diet. The correct answer is A. Take excessive precautions when you will be exposed to the sun. Chemotherapy and radiation therapy cause photosensitivity in patients. Patients should be educated to take excessive precautions when they will be exposed to the sun. Question 56. A mother in the transitional stage of labor begins having late decelerations, causing the fetus's heart rate to drop. What is the best intervention for the nurse to perform? A. Have the patient lay on her left side. B. Have the patient get on her hands and knees. C. Place the patient in a Trendelenburg position. D. Have the patient lay on her right side. The correct answer is A. Have the patient lay on her left side. When a mother is experiencing late decelerations, there is likely a compressed umbilical cord. Having the mother lay on her left side can decrease pressure on the umbilical cord, thus providing oxygen to the fetus. Question 57. A patient who has just undergone a mastectomy is being discharged home from the hospital after a 5-day stay. She was recently widowed when her husband's plane crashed overseas. What is the most important thing for the nurse to ensure to set the patient up for a successful recovery at home? A. Support system. B. Wound care dressings. C. Discharge paperwork explaining when to perform her wound care. D. Follow-up appointment in 6 weeks with the surgeon. The correct answer is A. Support system. This patient has just lost her husband and gone through a surgery that can cause her great emotional and mental distress. While it is important to provide the patient with the other options, for this patient a support system is key. Question 58. A nurse is assessing a patient's Foley catheter drain tube. The patient has previously had yellow, clear urine. The nurse noticed that there is heavy sediment in the patient's urine. What can the nurse most likely expect to do once notifying the doctor? A. Obtain a urinalysis with culture and sensitivity. B. Flush the catheter with normal saline. C. Change out the Foley catheter. D. Start the patient on antibiotics. The correct answer is A. Obtain a urinalysis with culture and sensitivity. This patient has previously been having yellow, clear urine. Sediment is often a sign of infection. The doctor may order for the nurse to flush the catheter if the sediment becomes thick. However, Obtaining a culture and sensitivity is the nurse's priority. Changing the Foley catheter out only puts the patient at a higher risk of infection. Unless the patient is running a fever, the physician will not likely order an antibiotic. Question 59. A 16-week pregnant mother being seen in her OBGYN's office is a Gravida 1 mother who explains to the doctor that she is worried because she has not yet felt her baby move. What education is likely to be provided to the patient? A. This is normal. Some first-time mothers do not feel their baby move until 18 to 20 weeks. B. The doctor needs to perform an ultrasound to ensure the baby is okay. C. The mother needs to have some IV fluids with glucose administered. D. The infant's heart rate must be assessed immediately. The correct answer is A. This is normal. Some first-time mothers do not feel their baby move until 18 to 20 weeks. It is normal for a first-time mother to not feel her baby kick up to 20 weeks or longer. This is often due to an anterior placenta on the front wall of the uterus. The fetus has a cushion between them and the mother's abdomen, so the mother may not feel the kicks until the fetus is larger. Question 60. A patient is being seen in his PCP's office due to pain and redness in his left calf. The site is hot and edematous. What is the most likely intervention to be performed for this patient? A. The calf will be drained with a large bore needle. B. The calf will be wrapped tightly to decrease the swelling. C. An ice pack will be placed on the calf. D. The patient will have an ultrasound of his leg. The correct answer is D. The patient will have an ultrasound of his leg. This patient is likely experiencing a blood clot in his left leg. He will need a stat ultrasound and is likely to start on blood thinners immediately. An extremity that is red, swollen, painful, and hot should never be wrapped tightly. This can cause the clot to move and become an embolus.
Thank you for watching this video. We hope you enjoyed it. Click the first link in the description to take the free NCLEX practice test. Also, check out these videos that can help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel, and please share this video with your fellow nursing friends.